Hello everyone. Welcome to the event which has been organized by Crescendo Worldwide. This is a very well-timed event at the end of the year. 2022 has been definitely, I think, is going to be a watershed year for India as far as the medical device industry goes. India has always been known as the pharmacy of the world. In medical devices, it's been lagging behind, except for the time in 2020 when COVID came, and then it was in the focus. Unfortunately, even last year, the medical devices imports continues to grow unabated. A steep increase by 41% in the previous year, and 63,000 crore rupees worth of medical devices were imported compared to 44,000 crore rupees in the previous year. China remains the top import source for India. Unfortunately, the imports grew last year by a steep 48%. This 48% increase in imports was from 9,000 crore rupees to over 13,000 crore rupees last year. Even from USA, the imports went up substantially from 7,000 crore rupees to more than 10,000 crore rupees. In terms of the medical device industry, which was making the products critical for COVID, from a peak capacity utilization last year of over 100%, the capacity utilization fell down to below 33% this year because of abating COVID demand. But there's been a huge rebound of demand for the non-COVID critical medical devices as elective surgeries started happening once again and standard healthcare interventions again came into importance. These were being postponed for the last 2 years, but of course you cannot postpone them forever. However, the manufacturers were caught between a very highly inflationary times as prices of plastics, steels, paper and energy spiked up this year. On the other hand, manufacturers faced intense competition from spare capacities being created in the last 2 years. And in most cases, they were unable to pass on the cost increase fully to their clients. So people have been having a tough time, even with the increased demand. On the policy front, it's been a fantastic year and very eventful. Many strategic initiatives under deliverance and whose impact will unfold over the next few years. The main developments that have taken place in the last 6 months. Number one, the government announced an extension of the PLI scheme. They also announced financial assistance to 4 medtech parks in Himachal Pradesh, Uttar Pradesh, Madhya Pradesh and Tamil Nadu. This is in addition to the 2 existing medtech parks at AMTZ and Telangana at Hyderabad. They also announced the creation of a revamped Medical Devices Promotion Council under DOP, which was earlier under DPITT, and also the creation of a Medical Device Export Promotion Council, which is being hosted at UP's MedTech Park. And additionally, the Ministry of Health was kind enough to listen to our requests, and they rescheduled the rollout of the medical device regulations from October 2022 this year to April 2023, and allowed the starting of the registration and regulatory processes for retailers and resellers of medical devices. And additionally, the Quality Council of India launched the ICMED Plus product certification for medical devices, which will help us to prove quality and credibility of our products to serious buyers in India and overseas. What has been most important and most exciting for us has been that in September this year, the Parliamentary Committee came out with a set of recommendations to create a separate law and regulatory framework for medical devices, and also recommended various steps to address the 80% import dependence. The most interesting one I would find would be that creation of a separate department for medical devices, or renaming of the Department of Pharmaceuticals as a Department for Pharmaceuticals and Medical Devices. They also recommended moving this department from the Ministry of Chemical and Fertilizers to the Ministry of Health. In addition, they realized the strategic importance that tariff plays in promoting manufacturing, like it has done in the case of mobile phones, And with that, they recommended to the government to review the tariffs to allow some sort of a protection for investors to come forward to invest in medical devices. They've also recommended to the government to create infrastructure for testing labs and to involve academia for R&D. They've also recommended the government to review the trade margins and the MRP policy specific for medical devices and to consider it separate from pharmaceuticals. We are more than hopeful and positive that the government will act on these recommendations. And by doing that, the government will help come out with a medical device policy, a draft of which was discussed with the stakeholders like IMED. And we understand it has been now passed by the cabinet and undergoing the rounds. And hopefully by end of this year or early next year, we look forward to its announcement. With this, we can hope and we are optimistic that we can realize our vision to be among the top 5 manufacturing hubs in the world for medical devices and possibly be the second factory after China for overseas suppliers to look at in terms of supply chain diversification to come to India to source their medical device procurement. Look forward to an exciting 2023. Thank you.
Good afternoon, everyone. What a wonderful occasion today I am part of. This is an inauguration ceremony of a medical device Digi Expo, a very innovative thought, which is the need of the hour. And post-COVID, you all know that how the healthcare has taken a great deal. I am very privileged and proud to be in the midst of great personalities like Mr. Thomas John of President ADMI, Dr. Nambiar of President DH India. Of course, Dr.Rajiv Nath is the one who is coordinating the entire forum. In fact, the whole subject itself is a very important for the reason. Government of India is also setting up, 22 AIIMS-like institution. And as you have seen, I being a part of the Ministry of Health for past 31 years, I spent in the ministry, where my main aim was to help the government in setting up a healthcare infrastructure as a specialized link. And also, all these aims and around 65 medical college upgradations have taken place. The whole idea of ministry was to set up the aims to have the faculty they have taken up, upgrading the existing medical college with the super specialty block so that the PG students of those super specialty will be the future faculty for entire running of these new institutions. I am also advising various states who are setting up medical college and district hospitals. And post-COVID, a realization has come in where every state and every district, and you know that under the Prime Minister ABHIM, that is Ayushman Bharat Infrastructure Mission, in which they are setting up critical care unit in every district and also trying to enhance the network of laboratory. These were the basic parameter we got, when we found ourselves lacking during the COVID. So post-COVID, these are the preparatory thing. And such a wonderful organization where there are going to be a participant from all over the world globally will know what are the needs of various country and the kind of advancement which we are looking for. And this conference, which is happening for 3 days conference, which will have a wonderful, feast of information for all of them, and a 4-day exhibition, which will help all those equipment manufacturer to have a B2B meeting also, and also understand each other's issues, and will be able to help globally supporting each other. Someone has some need and someone has a service provider, and there will be a good congregation of wonderful people. And of course, it is happening virtual because the timing of various locations are different. And to maintain that, It's very well organized by this CWW Limited. I congratulate and thank you very much for being part of this session. Thank you very much. Bye-bye.
Dear healthcare fraternity comprising cross-functional medical specialties like clinicians, pathologists, hospital administrators, stalwarts in other medical specialties, medical device manufacturers, supply chain stakeholders, distributors, and all healthcare fraternity. Congratulations for being a part of this great virtual medical device expo. My name is Thomas John. I am the Managing Director of Agape Diagnostics Limited. In addition to that, I am the President of ADMI, which is the association for the Manufacturers Association for the in vitro diagnostics, which is part of medical device. Medical devices are considered as a fundamental component of health system. The benefits they can provide continue to increase as they are essentials to prevent, diagnose, treat, and rehabilitate illness and diseases in a safe and effective way. Market size value in 2021 was around US dollars 186.5 billion. In India, the medical devices market is estimated to be at US dollars 12 billion, and it is expected to grow at a CAGR of 15%, which is 2.5 times the global growth rate. India is the fourth largest Asian medical device market after Japan, China, and South Korea, and among the top 20 medical devices market globally. India will definitely have prime position in medical device industry within a decade or two in the world medical device industry, following the path of our great pharma industry in building infrastructure in a big way as per the present trend speak. Such eminent trade shows like Medical Devices Digi Expo, at which healthcare and medical technology specialists from around the world come together to develop solutions, encourage innovations, speed up the process of discovering new possibilities, and improve healthcare at length. The revised and updated second edition of Medical Devices at Digi Expo, I presume that all will get the chance to speak with the leaders in the field of healthcare and medical technology. During this expo, national and international producers of medical devices and qualified buyers from around the world will display the most recent innovations and products advances in the field of medical devices for the globe. At the same time, the visitors' companies will have the opportunity to engage in one-to-one conversations with the exhibiting companies, either in real time or through the use of a pre-scheduled alternative. They get the opportunity to network and form business ties with the most reputable manufacturers of medical devices from across the world. I feel that prime objective of Digi Expo is to provide the stage for the presentations of business and products by more than 50 top tier exhibitors to 5,000 or more key decision makers from a varieties of countries including Africa, Middle East, India, Germany, Russia, and others. The expo will provide a fantastic opportunity for the participating companies to network with one another, grow on a worldwide scale, and do all three. Again, the dedicated deliberations called Medical Device Symposium, which will be held during the Medical Digi Expo Edition 2, multitude of prominent speakers, industry experts, and thought leaders from the healthcare and medical device industries will be present to part their knowledge and skills. At the Medical Device Symposium, attendees will have the opportunity to hear deep insights and analytical views about the future of medical technology for the mankind. I herewith express my heartfelt gratitude for the organizers for giving me an opportunity to be with you all today for this inauguration ceremony and share the views to you all. Thank you so much.
Good afternoon, everyone. At the outset, let me start by congratulating the organizers for bringing a very important group of stakeholders, which is the medical device industry, on a single platform. Now, healthcare industry has always been a very technologically driven and technologically intense industry. And the healthcare providers cannot hold their own without devices in all the functions of healthcare ecosystem. With the advent of digital technology, what we have seen, and especially more so in the last 2 to 3 years after COVID, the ecosystem is poised for very rapid changes, which we are seeing. The way it is the digital technology has been accepted by the patient care community and by the healthcare providers. This is going to grow in leaps and bounds. Now, in this entire changing ecosystem, what is very, very important for us to realize is what our primary objective is. And whether we are healthcare providers, healthcare technology solution providers, or device manufacturers, or implementers of this technology, our primary role always remains that of ensuring seamless patient care. I would say that in the last 3 years, we've also seen that patient care, the whole concept, everybody now realizes very well that it's not about just caring for people during their illness, but also ensure wellness. And for both taking care of people in the acute events or acute illnesses, as well as to keep the population healthy and well, we are highly dependent on technology. Now, in this if supposing we have to provide this, the technology developers or the device developers have a very, very important role. Now, to provide this seamless communication for care, we depend on the device manufacturers to ensure that there is communication of the data that is gathered by the different devices to be seamlessly integrated into the electronic medical record of the patient, which through various decision support systems provides the inputs that are required for the medical care providers, whether it is the doctors or the nurses, to be able to take care of the patient. It also fuels the entire wellness industry because it's all hugely data driven. So the information exchange between a device and the software that is important in taking care of the citizens and as well as the patients is a very, very important aspect to be considered by all the device manufacturers. Now, whether we do it directly through the device or through the middleware software solution developers, it is important that the device manufacturers keep this in mind. And it is going to become more and more stringent requirement as we go further. Whenever we are talking about information exchange like this, the primary thing that we need to figure out is how do we ensure that the data that is transferred is accurate, the data that is transferred is secure, and it does not compromise on the quality of care as well as the patient's privacy and confidentiality. Now, I would want every single person who is participating in this exhibition as a member of the device, I would say device manufacturer, to ensure that this is taken care, because eventually provision of healthcare is nothing but it's a data science. We gather data about the patients, we analyze that data, we decide a certain, whatever is the diagnosis and a certain line of management. And based on data of multiple patients, we also get, we analyze that for a cohort of patient, what should be the appropriate line of management. So it's extremely important that every single person who is manufacturing devices which have to be used in the healthcare system, this is taken care of. This would be my message in today's exhibition, and also in keeping with what we are seeing in the healthcare industry as the evolution that is happening, for which we all need to adapt as healthcare providers as well as people who are uh, making the devices. So I would not think that a device manufacturer now is just a vendor. He's an equal participant in care, because the data that is generated from the devices is what we use for healthcare. So to stop considering our relationship as a vendor-client relationship, but to look at how we can all partner in care and provide better patient care in future. And that, with that, I congratulate all of you again, and welcome to this exhibition. And I hope that you have all success during the next 3 days of the exhibition. Thank you.
Hello everyone, I am Bharat Kulkarni, Director CWW Limited. CWW Limited is an extension of Crescendo Worldwide, which is international trade and investment generating organization. Crescendo Worldwide is having global presence in over 100 countries in the world. Over the last 2 years, we are spearheading high-end interactive 360-degree walkthrough digital exhibitions. We at Crescendo Worldwide and CWW Limited are glad to have you as a part of Medical Device Digi Expo Edition 2, which conveniently connects global key decision makers to a common platform. This Medical Device Digi Expo Edition 2 will have opportunities and interactive features to connect, collaborate and grow with your strategic business partner in the international market, who could be a manufacturing company, act as supplier and buyer from the healthcare industry. The second edition of Medical Device Digi Expo looks forward for creating successful business ambience. We are glad to announce that for the first time in the healthcare industry, an exhibition is being held on Metaverse platform. This Metaverse platform, World Beyond, is created by CWW Limited. This Metaverse World Beyond will lead to various trade and business activities and will be the next future for the healthcare industry. The platform of Medical Device Digi Expo has technologically advanced features like product displays, trade halls, exhibition booths, 360-degree vision, live conferences, and much more to give you an engaging, interactive, immersive experience of the virtual trade show. By being a part of virtual event, you will be getting an opportunity to directly interact with the key persons of various organizations and also participate in specialized B2B meetings with top global component sellers and buyers. Once again, I welcome you all to the Digital Medical Device Expo and Medical Device Symposium. Thank you very much to all our distinguished guests, Dr. Chandrashekar, Mr. Thomas John, Dr. Uma Nambiar, Dr. Rajiv Nath, for joining us today and sharing your views on the Indian and global healthcare sector. I wish all participants good interaction, networking and successful collaboration opportunities in the coming 4 days. We will be having various sessions at the symposium parallelly to the exhibition. Visitors can visit exhibitors and interact with them. Thanks and have a great day ahead.